So I will divide my presentation into two small parts. The first one, I'd like you to present smoking as a modifying factor of human disease, since we generally look at smoking as a risk factor, but very few times as a modifying factor of other existing disease. And then I would like to talk about smoking and tobacco-heated product on the progression of very common and important diseases such as non-alcoholic fatty liver disease. So this is what I was just telling you. In this slide, you can see on your left side what is very well studied and well known, smoking as a risk factor of lung cancer, infertility, and cardiovascular disease. But of course, as I will try to show you today, and what is already known in the literature, scientific literature, smoking is impacting also on the disease progression, and of course, impacting on the disease progression, it may also impact and may cause itself other risk factor of other disease. So this is a very well known and established paper how, for instance, cigarette smoke promotes drug resistance on cancer stem-like cell site population, and is one of the ongoing projects for oncohematological disease in Center of Acceleration for the Harm Reduction in the University of Catania, but I will not talk about this today. Smoking after diagnosis of kidney cancer, and cigarette smoke for other lung cancer disease progression. So what about other more common and considered less harmful diseases such as non-alcoholic fatty liver disease, and why we are focusing on non-alcoholic fatty liver disease and liver disease in general? Probably most of you heard about the recent retracted paper about the harmful effect of e-cig and liver, which was retracted by the journal because it was not conducted properly, just to be consistent to what Professor O'Leary was saying in her presentation. What is the definition of non-alcoholic fatty liver disease? This is a clinical pathological syndrome encompassing a very wide range of fatty liver disease, so it's not just one single disease, in the absence, of course, of significant alcohol intake, which means 2 drinks or fewer daily, and of course in the absence of other common causes of steatosis, such as drug medication. It is a very common disease, and for instance, there is a survey on adolescent participants in the NANES. According to the ALT level, which is a surrogate marker of non-alcoholic fatty liver disease, it is present in the 8% of the USA adolescents aged between 12 and 19 years, meaning that the disease may already be present at the time when people they start smoking. So smoking using e-cig or tobacco-heated products or combustion products may impact of this disease. Of course, there are several grades of the disease. This pyramid show you the very start of the disease, such as microvascular steatosis, which may then be complicated by lobular inflammation, fibrosis, and then it may lead to cirrhosis, which is the last stage of disease. Actually, this is why we do care about NAFLD, because it may progress to a very severe disease such as cirrhosis, which requires liver transplantation. There is a very interesting study demonstrating that in 10 years, the number of liver transplant that we will perform on the metabolic basis, meaning on non-alcoholic fatty liver disease, will surpass those of patients affected by hepatitis C virus, which, as you know, also has been eradicated by recent drug medication by Gilead. So it's very important that we do care about the disease and we reduce the progression of simple steatosis towards very high-grade disease such as cirrhosis. This is the pathophysiology of this complex disease, and I put it in this slide we published long time ago, almost 10 years, but is still valid. Oxidative stress, it's at the center of the physiopathology of the disease. disease, meaning that increasing oxidative stress may impact on the progression of the disease. That was the starting of our idea. Then if we use products such as combustion products, combustion cigarette, which are known to contain many chemicals leading to oxidative stress, we would have expect a direct effect on the progression of disease. But let's see if what I'm saying you is true. So, of course, there are already some data regarding the impact of smoking on the progression of non-alcoholic fatty liver disease, but there are no studies, and the results I'm going to present you are the first and unpublished results so far, showing direct effect of cigarette or tobacco-heated products on the liver. So the only results that are present in the literature are related to the progression of the disease, which I told you it's multifactorial. So there is evidence that smoking increases the progression of the disease, but maybe because it's increasing insulin resistance, maybe because I heard this morning a very interesting from Russia increasing metabolic and lipidic disorders. So increasing lipid disorders may increase the intrahepatic lipid content, but there is no evidence so far except our data regarding direct effect on the liver. So this was the aim, as I told you and anticipate you, to test cigarette smoke and tobacco-heated products directly on hepatocytes in an in vitro model of non-alcoholic fatty liver disease. Of course, and this is one probably Professor O'Leary didn't have time to mention in this in her presentation, but I read one of his most interesting paper regarding measure flow in tobacco research, the use of non-proper means to expose cells to nicotine or to tobacco-heated products or the combustion cigarettes. So we still keeping looking at papers that are using non-clinical relevant conditions. So we use a smoking machine and a vaping machine for expose cells by an impinger for the in vitro model. We then take the sample from the impinger and we measure nicotine in order to compare tobacco-heated products and cigarette using the same concentration of nicotine, which we believe it's the right way when you want to compare these two different compounds. Otherwise, we are talking about nothing. We then measure, of course, gene expression, cell viability, and high through output biology, as I will show you in a few moments. This is just the model that we use in this video. I don't know if this is starting. It was working. Okay, now here you see hepatocytes that were treated with palmitic and oleic acid in order to mimic an in vitro model of steatosis. The white points that you see that are increasing inside the cells are the fatty content inside the cells. So by the time is passing, you will see the white spots increasing, meaning that the cells are uptaking the fatty acid, and we are mimicking a situation that is very similar to non-alcoholic fatty liver disease, which, as I told you in the definition, is the accumulation of fatty into the liver. Then, of course, but this time I have to say it works. Artificial intelligence, after segmentation of the cells, allow us in this graph to measure for each cell's lipid content. So I have, in this case, I have some different position, but I don't want to open an issue about this. And we measure the content of lipid content inside the cells. Of course, as expected, when you treat the cells with oleic acid and palmitic acid compared to untreated cells, you significantly increase the content of fatty acid, and there is no significant increase, so there is no worsening of intrahepatic lipid content following exposure at different different concentration of combustion cigarettes or tobacco heated products so far compared to palmitic acid and oleic acid alone. However, when we treated cells with the same concentration of nicotine, and in particular low concentration of nicotine, 1.25 micromolar, we observed a beneficial effect of nicotine on intrahepatic lipid content. But this was also well established in an in vivo model, but I will tell you more just in a few moments. Then we also measure the impact on cell viability by using a label-free analysis, real-time monitoring. This is the control with black spots, and the white spot is oleic palmitic acid. Of course, when you treat cells with oleic and palmitic acid, you have a significant reduction of cell viability over the time. When you treat cells with tobacco-heated products or with a combustion cigarette, you do not observe a significant increase in cell viability, decrease in cell viability. So, meaning there is no direct effect of this compound on cell viability. So we want also to test mitochondrial fitness under our condition. Here this again artificial intelligence, the high through output mechanism. We staining mitochondria with a special stain that is which is the mitotracker, and then with artificial intelligence we go and measure mitochondrial fragmentation. When there is an impairment of the mitochondrial bioenergetic pathway, the mitochondria start to do nasty things. It can go fragmentation, it can go fusion. So two mitochondria fuse together in order to increase their performance, or they can go to mitochondrial fission. That are two completely different systems, which of course in the long term may leads to dysfunction of the cells. As you can see here, there is no significant effect of both tobacco heated products or combustion cigarettes on mitochondrial fitness when tested and compared to the same concentration of nicotine. Here again you can see again in particular 1.25 micromolar, some beneficial effect after 18 hours, again very similar to the control of nicotine alone. Again, but this was known, we were talking about before the session started with Professor Poulas. It is well established that nicotine alone may have some beneficial effect, even though at least in Italy, if you ask to 10 doctors was about nicotine, 7 doctors they are saying it's causing cancer. So hopefully after the 6th edition of this meeting we will try to see, or 2 or 3 only doctors will say this very interesting stuff. Again, we measure polarization of cells, that is the mitochondrial membrane potential. Again, there is no significant effect on combustion cigarette. Interestingly, when we go to the tobacco heated products, at least to a very low concentration, 125 micromolar at least, there is preservation of mitochondrial potential. Again, similar effect were observed with nicotine alone, meaning that at least on the mitochondrial potential there was an improved effect of tobacco-heated products compared to combustion cigarettes. So this is what I was telling you before. In particular, it was established if you take mice and you make him on, you put him on a high-fat diet, so he becomes obese. So look at the lower part of these 4 pictures. Oops. of this picture, then you will see that the red part is the fat content. When you treat cells, when you treat animals with nicotine, you see here the red part of the animals is significantly reduced, meaning that it was established that nicotine may itself impact on mitochondrial function and on lipid metabolism in reducing the intracellular hepatic, or in this case adipocytes content. So this was something that was already known in the literature. Again, if you look at fission, this is a gene, it's called FIS1, that is related to the fission of the mitochondria, which is a biological process of the mitochondria when there is an impairment of the energetic balance. You can see that nicotine treatment at least 1.25 micromolar compared to the other treatments significantly reduce this abnormal process known as fission. And this is again the demonstration that what we observed in mice, it's consistent to what we observed in cells. T-form, it's a way to measure mitochondrial mass in the liver. As you can see here, nicotine treatment increase the number of mitochondria. So probably the reason why with nicotine alone there may be an improvement of lipidic profile or increase or decrease in intracellular lipid content may be dependent not just on the functioning, fission and fusion of the mitochondria, but also on the number of the functional mitochondria, which of course, you know, they are oxidizing in the beta oxidation the fatty acid, reducing the amount of fat inside the cells. So this is the last and the most important slide of my presentation, because none of what I presented you would have been performed without the assistance of my staff. In particular, let me thank Professor Daniele Tibulla and Professor Massimo Caruso. They are both part and members of the Center of Excellence for the Acceleration of Harm Reduction, Angela Maria Morini and Lazzarino for their nicotine content determination, Alfio Di Stefano and Lucia Longhitano for cell culturing, and of course the inspirators of this work, in particular Professor Riccardo Polosa, who was the former founder of the center, which I have the privilege to chair. Thank you for your attention.